Welcome to Educating Yourself, 4 things you must research to improve your healthcare. I'm Tiffany Matthews, and I'm going to walk you through all 4 things that you must research to improve your healthcare. They're things that you can do right away and go to your next appointment empowered. So I hope you'll stay for the entire presentation and find out a little bit about how you can empower yourself as a patient, a little about me and my business, and mostly how to navigate the system effectively. These 4 tips are foundational steps for you to improve your care. So let's go inside. My presentation today will consist of a few different topics. We'll talk about the status of healthcare now. We'll talk about the 4 areas of your healthcare that you need to research. And then we'll do a little breakdown of each area and let you know what you can do right away. So again, I'm Tiffany Matthews. That's when I had a better haircut before coronavirus. But I am founder and CEO of PACE. PACE is an acronym for Patient Advocacy and Caregiver Empowerment. The BSW behind my name is a bachelor's in social work. I've been a social worker since 1994, and once you're a social worker, you're always a social worker. So shout out to all of you. The MJ behind my name is a master's in journalism. I think I write pretty nicely. And then finally, and what's most important for you, is the BCPA, which means I am a board certified patient advocate. And I am an independent advocate. I don't work for any healthcare system, doctor, or healthcare professional. I work by myself, for myself, so I can my allegiance can stay with patients. A lot of advocates are being hired right now, and that's a really good thing. But when you look for an advocate to help you, you want someone that's completely focused on you. So an advocate that works for a doctor or for a healthcare system is an advocate for that system or that doctor. You need an independent patient advocate to make sure that patients' and families' interests are taken care of in the system. I've been in healthcare since 1998 and social work since 1994. The dysfunction in the system really made me angry, and I had to work in that system just to get my paycheck and feed my little girl. So that was, of course, priority 1 to me. But in the system, I've had to be a party to things and do certain things to get that check, which were a little less than desirable for patient outcomes. It happens all the time. It happens in hospitals. It happens in nursing facilities. It happens at clinics. When you are a patient, you really have to know how to stand up for yourself. You must know what to say, do, and ask in the system. That and my family's negative healthcare and caregiving experience really inspired me to open PACE. I had to help my family with some healthcare situations during the time where my grandmother was at end of life. A negative healthcare situation came from that. And because my mom was the closest living female relative, she was automatically drafted into doing caregiving, which affected her life, her emotions, her mental health, her job. There were so many things that were negatively affected, but my mom was just trying to do something extremely noble. Assistance for caregivers in this nation, you have to be lucky and qualify for certain things. You either have to be very rich or very poor. Those people in between are pretty much out of luck. I'm hoping to change that. I'm hoping to empower women to demand better healthcare delivery, to change the system. If we have numerous amounts of women, caregivers, patients demanding better care, then the system has to meet our need. That's the information I want to empower women with at PACE. I want to make sure that you know how to navigate healthcare and get the best out of it for your money. I want to teach you consumer tips, increase your health literacy, and make sure that you know how to navigate healthcare effectively and confidently. That's my hope for all women. And in turn, these women will take care of the men in their lives. The status of our current healthcare system. Oh boy. Well, I'll talk a little bit about healthcare before COVID-19 and after. Boy, it's tough. The healthcare system right now, well, before COVID, left a lot to be desired. Clearly, there is bias. There is racism in the system, and women, particularly women of color, suffer in their care and treatment because of these biases and discrimination. Not only bias and discrimination, we have astronomical health care costs. Everybody knows that. I know it. You know it. We all know it. We're paying for premiums. We're paying co-pays, co-insurance. We're paying deductibles. We're paying all kinds of things into the system to get care if we need it. But the delivery of that care that we pay so much into leaves a lot to be desired from many healthcare providers. Now, after COVID-19, oh boy. COVID-19 has been the 9/11 of the U.S. American healthcare system. It needed to be said. Healthcare in America has collapsed under COVID-19. We have hospitals that can't keep up with the demand still. We have upticks of COVID everywhere, and we've got this disease that no one knows what to do with. We have lots of theories and a vaccine coming to manage the virus, but as of right now, and having recently talked to many healthcare providers, the personal protective equipment situation isn't much better than it was in May and June. There's still a lot of reuse happening. There's still a lot of not knowing happening in our system. That happened before COVID, but it's more pronounced now. And with COVID-19, what else is more pronounced is that very same racism and discrimination that I speak of. Systemic racism will affect your health and your health care. So you still need to be an effective patient when you're in this broken, disjointed, biased system. You still need to know the things to say, do, and ask when you're in the system. So these 4 tips that I have coming up will surely help you out. Fun fact about our healthcare system. Annually, we spend, that should be a T and not a B, pardon me, $3.4 trillion, not B, it should be a T for trillion. Oh, that's a lot of money, needless to say. That's more than I think someone can count in an entire lifetime. We spend that annually. From 1/4 to 1/3% of that 3.4 trillion is wasted. Completely wasted. It's wasted on all the supplies that were ordered and expired, so they're thrown away. It's wasted on healthcare providers that feel that they can defraud the system and get more out of insurance than they actually deserve. And it also comes from a concept called overtreatment. Many doctors are afraid of malpractice these days, and I cannot say that I blame them. But they're trying to protect themselves from lawsuits, basically. So a doctor may give you 5 lab tests as opposed to 1, or 3 diagnostic tests as opposed to 1, just to make sure every area is covered. Those kinds of testing and treatment aren't always warranted. But because a lot of providers want to make sure they do everything for their patients and secure themselves away from a malpractice lawsuit, they're going to go beyond what you need and overtreat you. That costs us every year. Your healthcare is a very, very worthy investment. So worthy that hopefully when at the end of this presentation, you've got yourself up and moving and ready to go, ready to research these 4 areas that you need to improve your healthcare. And as I said, you can do it as soon as possible, possibly at your next healthcare appointment. So educating yourself on the important aspects of your care and treatment is so critical. I cannot explain how critical it is for you to be informed about your care and treatment and to give input and to make sure that your needs, unique needs, are met. The real return on investment for putting the effort into your healthcare to make things better, to deal with the different aspects of care that you have to deal with. The return on the investment of effort in that is patient satisfaction, patient power. You can walk into the system confident that you know how to navigate it. You know how to effectively get what you need out of your healthcare appointments for yourself and for your family. You have education on the system, education on your unique needs and what you need particularly out of the system. You can navigate it effectively using less time, less money, and less energy and stress. And most of all, you have input on your care and treatment, as every single patient should have. And if a patient cannot have input, their caregiver should have it. All right, finally, I've done enough talking about everything else. Let's get to the 4 things you must research to improve your healthcare. And here they are. The 4 areas to research to improve your healthcare are your conditions, your medications, your healthcare providers, and your healthcare facilities. These are very important aspects of your care. Each one of them has a particular focus that you need in order to be able to go into the system and know what you're talking about, knowing how to navigate it confidently and effectively. So your conditions, let's start there. Very important. You need to be familiar with all your conditions and how they'll affect your life. So, what is the condition? Is one of the first questions you can ask. Let me get to the next slide here. What is your condition? Many people have the same kind of condition. Take diabetes, for instance. I have happened to have been diagnosed with diabetes in 2017, and I think I really wore my doctor out with questions. But that's because I knew what to search for and how to get my questions answered. And a lot of times, providers don't have time to talk to you or educate you as you need to be. Everyone's unique needs have to be met in healthcare, and they also have to deal with the disease itself and how it uniquely affects you. I have friends with diabetes, and my treatment plan is much different than theirs. So, how will the condition affect you in particular? Again, for me, I don't have to do insulin or take medications for diabetes, thank God. But some of my friends do. We have the same disease, but we have it at different levels. My one friend needs insulin. Another friend needs metformin. And thank God I don't need any of those things. At least not now. My diabetes is well controlled with diet and exercise. So, what are the symptoms of your condition? Headaches can lend to a lot of different conditions. Chest pain can lend to a lot of different conditions. I know the first one you're thinking is a heart attack, but there are a lot of different conditions that can lend to consistent chest pain. So you need to know the symptoms of your disease and how they affect you in particular. Your friend Mary can have the same disease, but it may affect her. Let's take diabetes, for example. Her blood sugar can fluctuate every hour, where yours may not fluctuate except from maybe day to day. All things can be different. Again, I can't stress enough. Ask about the needs that are unique to you as a patient and a consumer, because when you're in the system, you are both. How will the condition be treated? One thing that you really must understand, and I keep stressing unique needs, is that your treatment plan is particular and unique to you. I do believe in healthcare that treatment plans need to be more holistic and bring in the other aspects of life that can affect healthcare. Your job, your environment, where you live. Is your car running? That can stress you out. You can go to the doctor with high blood pressure because you're stressed out behind your car. You're diagnosed. Well, it's not that simple, but you do need to know in particular how the condition that you have will be treated. If you get forms from your doctor, make sure they include different bullet points or a list of things that you need to do to manage your condition. And again, with individuality, you can ask your provider, how will I be treated individually? Not Joe or Mary or Tamika. How will I be treated individually? What will you do for me? What do I need to do? You can ask providers endless questions about what's going on with your condition, but you must also do your part and make sure that you monitor your condition as your doctor sees fit. And next, medications. Now, if you have a chronic disease like me, then 9 times out of 10, you may need medications. Now, I have medications for different things. I know I just told you I don't take meds for diabetes, and I don't. But the medications that I do have, I'm extremely familiar with. I challenge you to do 2 things. When you get a medication at your doctor, I challenge you to ask questions about it. And I also challenge you not to just take it because your doctor said to do so. You have to be keenly aware of how medications will affect you and your life. Will they make you sleepy? Will they make you tired? Those sorts of things. So again, you must know everything about your medications and how they will affect you. Here's another tip that I didn't even write down in this presentation, but I want to give it to you. I suggest becoming very close to your pharmacist. You don't have to hang out and go out to the movies or anything, but make sure when you go that you build a very good professional patient-provider relationship. Good relationships with your healthcare providers are directly related to improved patient satisfaction and improved patient healthcare outcomes. So, not only with your pharmacist, with all your providers, you should use that kind of partnership strategy because they are your partners in your care. So, with medications, you can ask your provider whether you're just getting the medication or whether you've had it for a while. Well, if you've had it for a while, I'm sure you know the first question. What is the medication? One thing that I make sure that I do is when I get a medication, I look at it and I make sure that I identify it. I have a friend who manages her medications by taking pictures of all of her medications and doing the little text over the pictures so she knows which one is which. You can find a system that meets your needs with that, but you first need to know what is the medication. You'll also need to know how it will affect you. What are the side effects of your medication? Now, I have some medications because I've had my spine operated on twice. I have pain medications, and the side effects, of course, are being tired or groggy or a little bit woozy. I understand that. So when I take them, I'm not trying to go out and go to work. That's obviously something you know. You're smart and savvy patients. I'm only trying to improve your consumerism just a little bit. Now, the medication, you'd also want to know, how does the medication treat the condition you have? You want to know how it's going to work. What's it going to do inside your body? When you get your actual prescription, you know those little papers they staple to the bag? I suggest you read those. I know it's boring, I know, but I suggest you do it. It's going into your body. You want to know what the possibilities are. How do I know the medication is working? You can ask your provider that. There may be improvement in your symptoms. You may have some other things flare up. Who knows? You have to monitor the good and the bad with taking all kinds of medications. And one last thing that you can ask your provider is, can I afford this medication? Or will my insurance cover it? I like to make sure that providers do their due diligence when they're prescribing medications to me. So I ask them to tell me, is this medication covered by my insurance? And they'll find out for you. It's not a problem. If it becomes a problem, then that may be something else to look at. But that's another lesson for another time. Your healthcare providers. Well, healthcare providers, you must do your due diligence on this. You really need to know who's prescribing you medications, who's monitoring your health, who's taking care of your body. I need to know who you are and be familiar with you and how you work. Now, when you go to a new provider, obviously you can ask questions and it'll take time to get comfortable. But whether it's a new provider or a provider that you've had for years, the questions and the tip, the breakdown of this tip will help you go in and monitor things and find out maybe just a little more than you knew about your provider. So, again, forming a partnership with your provider is the best way to manage your care and treatment. But you have every right as a healthcare consumer and patient or caregiver to ask about their background. So some things you may ask about your providers, and Again, you have every right to ask as a healthcare consumer, what is your education and experience? How long did you go to school? Where was your residency? Are you a diplomate? Do you have extra training that's going to be specific for my conditions or diseases? How long have you been a doctor? You can ask all of those things, and any doctor worth their salt should be happy to answer it for you. Most doctors' offices that I've been in have degrees all over the wall. So, and just to be specific with the provider, you can ask, do you have experience with my specific needs? Again, healthcare is an extremely personal experience. You're going to talk about things that you don't want to. You're going to have to deal with things that you don't want to. You want a provider that's going to have your back. It's going to be a partnership from day one. And it's going to be a great thing if it works out that way. But first, they need to have the experience you need. So ask them. And if they do have experience, how much do they have? If it's about a surgery that you need, how many of these surgeries have you done? How many have been successful? How about unsuccessful? Okay? And as you're asking your provider these questions, I want you to do something in the back of your mind. I want you to feel for commonalities and synergies that are between you. Energy in a relationship with your provider is extremely important. If you feel you have a provider that may talk down to you or do things that you don't ask, or in any other way do something that you don't like or is disrespectful, you have the right to address it and get a solution or leave. You also have the right to be extremely comfortable. In healthcare, it's so personal. You have to be comfortable to be able to say the things that you need to say. You have to be comfortable and confident to do what you need to do and ask the things you need to ask. And another question for your provider could be, how would they approach treating your condition? For example, when I was diagnosed with diabetes, I went to an endocrinologist. I looked through her records. I looked her up on healthgrades.com, which is something, a website where you can go and look up records for doctors and information on them. Again, it's called Health Grades, like grades in school, healthgrades.com. Another place where you can do a little bit of research on your providers beforehand is called docinfo.com. docinfo.org, docinfo.org. You can also go to ProPublica, and they have a department called Vital Signs. And you can put your doctor's name in there and look up information for them there as well. You must do your due diligence with your providers. And our next slide is going to address the times we're in right now. And I've asked some of my providers this, and some of their faces dropped, their mouths hung open. But yes, this is my health, my care, and my life. And I wanted to know this, especially recently. In the era of social injustice, as well as the healthcare system being plagued with racism and gender bias, you absolutely have the right, as a person of color, to ask, are there any racist or otherwise discriminatory activities that you have participated in now or previously, or any accusations towards you of such? Now, let's be honest. I don't know too many providers that are going to really say, oh yes, I dressed in blackface in college. But this really is a way to shake them up. And you may hear things about doctors' reputations and things like that. I'll just say this. I wouldn't want a racist touching my black body. And in healthcare, they may have to, no matter what their background is. So the most you can do, again, is your due diligence in researching your providers. And last, but certainly not least, you should research your healthcare facilities. This is something else you need to be familiar with. Your healthcare facilities, your local facilities, you need to know if they can provide the care that you and your loved ones need. Do you know that right now? Are you sure of the facilities that you go to and whether they can treat the needs of you and your family and your conditions and your treatment plans? If not, you should do a little research. Now, you could ask these questions of a provider, or you can look things up yourself. There's lots of information about hospitals, clinics, and urgent cares online. Whether you go on an emergent basis or for a planned surgery, these facilities should be able, your local facilities should be able to help you and meet the needs that you have for you and your family. So you can ask your provider or look online to discover, does the facility that you're going to treat the conditions that you and your family have? If not, you're wasting your time. There's so many hospitals and healthcare systems that say, oh, we're great at cardiac care. Oh, we're wonderful with stroke care. And there are others that say, oh, well, our orthopedics is great. It's difficult because you do want to try to stay within one healthcare system. It's easier for your providers in that healthcare system to be on the same page. But if you're like me and I want the best care possible, I do actually switch my healthcare between two local Philadelphia healthcare systems. One, I have my primary NGYN, and then the other healthcare system, I have all my specialists. So it's also my job to keep them in communication. So I document my appointments and I let all my providers know what they need to know. Now, back to facilities. What is the reputation? If you're like me, you've heard, oh boy, don't go to that hospital. They'll kill you. Check out the reputation of the clinics and facilities and urgent cares that you're going to. You deserve the best care, but you also have to go and look for it. It may not be where you're going right now. And again, the inevitable money question, can I afford it? Will my insurance cover it? And with facilities and insurance coverage, please, please, please make sure that where you're going, your insurance covers that facility and any services you get in it. I know a friend of mine and another colleague actually, who both went to the same doctor in two different facilities, and their insurance covered one but not the other. So you have to be, even if it's the same provider, make sure that you can see them at the particular facility where you're going. And lastly, the facilities where you're going, do your providers practice there? It would be helpful if your providers had access to the healthcare system you want. So that takes care of that. So in conclusion, I know this was a lot of information, but I really, really hope that I got you moving and wanting to check into these things. Again, the 4 most important areas that you must research to improve your health care are your conditions, your medications, your healthcare providers, and your local healthcare facilities. If you do that due diligence, I promise your healthcare will improve. Your confidence in getting your healthcare will improve. And that'll drive you to do more. And that'll drive you to be a better patient, which is the mission for me. If I can do that for you and help you be a better patient and have a better healthcare or caregiving experience, then I've done my job. So I thank you so much for being here, and I hope that you got some good information out of my presentation, and that hopefully we can do this again sometime. So you can come and talk to me, Jodeci plug, at my email is info@advocacybypace.com, and my website is advocacybypace.com. Please reach out to me via email. So if you want better health care, you need to pace yourself. Thank you for joining me for this presentation. I'm so happy you were here. And please give me a shout if you have any questions. Other than that, do the best by your health care and become a powerful patient partner. Thank you.